The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
May is National Stroke Awareness Month. Here to share the warning signs, importance of quick treatment, and how you can reduce your risk, we welcome from Providence Stroke Center neurologist Annie Chiu. Good to have you with us.
Thank you.
So first of all, let's talk about what a stroke is and how it affects the body.
Sure. So a stroke is a brain emergency. It's when part of the brain doesn't receive enough blood, and that can happen through different ways. It can happen through a brain bleed or a blood clot in the brain.
Oh, wow. And I understand there's a term that we use to kind of give us a heads up. Be fast. Tell me what be fast means.
Sure. So be fast is an acronym. It's kind of a short and simple way for us to remember the signs and symptoms of stroke. So B stands for balance. If someone you know or you experience a sudden loss of balance or dizziness, that can be a sign, symptom or symptom of stroke. E is for eyes. If you lose vision in one part of your visual field or one eye doesn't work, that could be another sign or symptom of stroke.
Okay.
F is for face. If your face feels numb or it's droopy. A is for arms. So if one arm is clumsier or weaker than usual or it's numb. S is for speech. If you have trouble speaking, like you can't get the words out or the speech is garbled. And T is for time. It just kind of underscores the importance of calling 911 immediately when you see these signs or symptoms.
Right, and get them to the hospital as soon as.
Right.
There's a process called door to needle, and it's a process that you have for treating stroke patients.
Yes, so door to needle time is the time it takes from when a person comes into the hospital to when they get treated for a blood clot stroke with a medication. And every minute that passes during a stroke, up to 2 million brain cells can die. So getting that door to needle time to be as short as possible is really important in saving as much brain as possible.
How does Providence help to try to lower that time?
Yeah, so our hospitals are constantly reviewing our processes to shorten that door to needle time. One of the things we do is we have a pre-alert system. So when the ambulance picks up a patient who might have a stroke, we get alerted before the patient even arrives in the hospital. So when the patient comes through that door, our whole team is ready to help assess that patient and treat them as quickly as possible.
I understand that there's been some awards because of this.
Yes.
Yeah.
Providence Certified Stroke Centers have won the highest level of recognition from the American Heart Association and the American Stroke Association for fast door to needle times.
Wow, that's great.
Yeah.
But let's say you don't get the person to the hospital in time. What are some of the lasting effects that can happen?
That's a great question. So the lasting effects really depend on where the brain is affected. We at Providence try to use a multidisciplinary approach. So we have our patients assessed by multiple teams. So speech pathologists, occupational therapists, physical therapists, and we use this multi-pronged approach to get our patients rehabbed as quickly as possible, to get them on the road to recovery as quickly as possible.
And then how can we ultimately prevent strokes?
That's a great question. Ultimately, it comes down to lifestyle and a good relationship with your primary care doctor. So lifestyle changes like a heart-healthy diet, exercise, avoidance of tobacco, and a good relationship with your primary care doctor who monitors you for long-term chronic illnesses like high blood pressure, high cholesterol, and diabetes. Those could either increase your risk of stroke, or if they're managed properly, they can decrease your risk of stroke.
Wow, that's incredible. Thank you so much for all this great information. I appreciate it. We're going to let everyone know if you would like to find out more, you can contact Providence Stroke Centers of Oregon, ka2.com/Family Matters. Thank you again, Doc. All right.